So when we plant the seed, we have to give it time, nurture it, and then reap the fruits. But, sad to say, a lot of patients might not have this mindset. So physical medicine and rehabilitation is important for patients, of course, who have undergone some form of surgery. We can help people who have had fractures. We can help people who have had hip or knee replacement surgery, and even patients who have brain or spine surgery. We help to relieve pain, improve function, and get them back to what they were doing before the operation. If possible, we can help them to literally get back on their feet as soon as they can. We can assess a patient's condition by getting a good history of the present illness and combining this with a very comprehensive physical examination focused on the problem at hand. If necessary, we have what we call musculoskeletal ultrasound, which can give us a real-time image of what's happening with the patient's shoulder, what's happening with the patient's wrist, and we can show the patient immediately what's happening. And based on this, we can actually formulate a short-term rehab goal so that we can tell them what we can and what we cannot do. We actually use physical measures like their strength, their endurance, and we can see, of course, their level of function. If they're doing better, we can then move up to the next level. What we try to do, of course, at first is to relieve the patient of their pain if they have it. We then try to improve the range of motion or the flexibility of their joints. After this, we can then move on to improving their balance and strength. And hopefully, we can then work on improving their endurance. Depending on the condition of the patient, we can use exercises that can improve the strength of their arms and of their legs. We can also use targeted exercises that can help with flexibility, strength, balance, stability, and endurance. Of course, we look at the patient as an individual and we see what the patient needs. And based on this, we work with the patient. We give them an approach that is tailor-fit to the specific condition or diagnosis that they have. Rehabilitation medicine complements with surgery and with pharmaceutical management of the patients. We can help the patient get back to their highest level of functioning before the patient had the operation. Sometimes we can even start rehabilitation even before the surgery. We call this rehab, so that we can improve the condition of the patient and improve the outcome after the procedure. We can also help decrease the need for painkillers for patients who have undergone pharmacologic management for their pain. As of course we know, too much painkillers is not too much of a good thing. We have to get down. Again, this goes back to treating the patient and his condition, and not just treating the symptoms. So a good physical rehabilitation specialist will dig deeper into the root cause of the pain and not just give painkillers and address the pain at its root. Personally, I do my best to read journals, and I think all doctors do that. This is what teaches us most of the knowledge that we have to keep us up to date. And I also believe that by teaching, we learn. And by God's grace, I've had the privilege of teaching other doctors here in Manila, in Hong Kong, and also in the United States on the proper use of musculoskeletal ultrasound as an extension of our physical examination. We have now the capability to see in the clinic a patient with shoulder pain and to tell them in 10 minutes if they have a rotator cuff tear. And I've also worked as an author for a chapter of a book on ultrasound-guided regenerative medicine. I think that teaching on the international stage and writing chapters for medical books has allowed me to very much keep up to date with the latest trends in physical medicine and rehabilitation. We have to put the patient's present condition into context. Again, it goes back to what the patient is experiencing themselves from a good history and a good physical examination. Based on this assessment, we can, of course, say that all patients are different. No two patients are alike. And What we have to do is we have to talk about what we can and what we can't do. We have to be able to make them realize that we have to work with some goals that should be realistic to the condition that they have. We tell them that this treatment is a process and it will take some time. Many patients think that rehabilitation medicine or physiotherapy can work instantly. Think of instant coffee or instant noodles. But we just have to tell our patients that this is a process that follows the proverbial law of the farm. So when we plant a seed, we have to give it time, nurture it, and then reap the fruits. But, sad to say, a lot of patients might not have this mindset. So we have to bring them back and tell them that for patients with chronic pain, this can keep on coming back, and we just have to deal with it as best as we can. I think patients should come to their session wearing loose, comfortable clothing. I would also like for our patients to give us immediate feedback about the exercises that we're doing during the rehabilitation treatment. If they're experiencing pain during stretching or during any exercise that we're doing, they should let us know. We could, of course, adapt and make sure that the patients are feeling much better while we're doing this. The sooner we know what's happening during the treatment, the better we can adjust and help them with their needs. As you know, when we do these rehab sessions, we can't do too much, and yet we can't do too little. And sometimes it's walking through that fine line that will get us places when we do physical medicine and rehabilitation interventions.